So today we will see endocrine system. Okay, so endocrine system procedures also bit important whenever you want to code same day surgery procedures. So regularly you will get procedures from endocrine system, mostly thyroid gland or thyroidectomy. Okay, so first in endocrine system we need to learn thyroid gland. So as usual here we have thyroid gland. So this is the thyroid gland. Okay, so in the documentation always you will see sternocleidomastoid muscle. Okay, thyroid cartilage, left recurrent laryngeal nerve. Okay, hyoid bone. So these are the anatomical structures related to thyroid gland. Okay, so first we have incision. Okay, 60,000. Okay, IND of thyroglossal duct cyst infected. Okay, so we will see thyroglossal duct cyst. So this is the thyroglossal duct cyst. This is the thyroid gland, hyoid bone, thyroglossal duct cyst. Simple. Okay. So here for IND of thyroglossal duct cyst 60,000. Next we have excision. Okay. So biopsy thyroid, percutaneous core needle. So basically this is the needle biopsy, percutaneous core needle. So through the skin patient will insert the needle and he will take biopsy from the thyroid gland. Okay. So along with this biopsy of the thyroid, if the patient performs imaging guidance, you need to use 76942, 77002 based on your imaging modality. Okay. Next, if the patient performs fine needle aspiration biopsy of thyroid gland, you need to go from integumentary system. So how do you differentiate, guys? For example, you have the documentation. So how do you decide whether you need to code from 6000 series or 1000 series? What are your keywords?
First, we have to check the site.
Yeah, site
if
correct.
This skin level, we have to. With this skin level, we have to code one series code.
Okay.
Otherwise, appropriate system codes.
So basically, if you see this one 60100 100, so this is tissue biopsy. Here fluid biopsy. See here aspiration. Aspiration means fish will aspirate the fluid biopsy. So what is important here? Whenever you want to code biopsy of the thyroid, you need to check outcome of the thyroid biopsy, whether it is fluid or tissue. If it is tissue, you can code this one 60100, and here your keyword will be core needle, not fine needle. Okay, the documentation contains core needle, you need to use 60100. The documentation contains fine needle or FNA, you need to code from integumentary system. So that is the key thing you need to remember. 60100 we will see once. So see here one. This is a diagnostic procedure in which the provider removes a tissue sample from the thyroid gland, typically under imaging guidance using an automatic spring powered core needle. Got it, guys? So how do you code now? How do you decide whether you need to code from 6000 series or 1000 series?
If it is tissue, then we can code 6000 series.
Perfect.
And core needle biopsy. If it is the fluid outcome, then we can code 1000 series.
So yeah, correct. So basically, so this is standard guideline for any biopsy procedure, not only for thyroid. Okay. So this is common for each and every anatomical area. So you need to check whether it is core needle or not. Okay, and also you need to check whether physician is sending tissue samples to the histopathology or cytology. So the patient sent samples to cytology. So histopathology or the patient sent samples to the cytology. So what do you code that one? Which sample patient will send to cytology?
Fine needle, sir.
Yeah, perfect. Fine needle.
Fine needle.
Yeah. So like that. So based on the output of the biopsy also, you can code. Okay. So most of the time you will see these procedures in lung procedure, bronchoscopy. We have fine needle aspiration, like that we have codes, correct? Fine needle aspiration biopsy and cryo biopsy. So like those procedure you will see in the bronchoscopy procedure. Okay. 60200. Excision of cyst or adenoma of thyroid or transection of isthmus. Okay. So here physician will remove the cyst or adenoma of thyroid. So here physician is not removing the thyroid gland. So he is removing only lesion of the thyroid or cyst or adenoma of thyroid. Okay. So next 60210. Partial thyroid lobectomy, unilateral with or without isthmusectomy. 60212 with contralateral subtotal lobectomy including isthmusectomy. Okay, 60210. Here thyroid gland has two lobes. Okay, so if the patient performs any one lobe, you need to code 60210. So tell me in this code what is mandatory or what is not mandatory. 60210. What is not mandatory?
With or without isthmusectomy.
Yeah, perfect. So here you don't need to worry about the isthmusectomy. If the patient performs partial thyroid lobectomy unilateral, you can code 60210. Okay. So basically here patient will not excise the complete thyroid. So even unilateral thyroid is also having the lobes. Okay, we will see, or I will show you. Okay. So this is the thyroid gland. This is the thyroid cartilage. Right lobe, left lobe. In this code 60210, patient will not remove total thyroid like right lobe. He will remove part of the right lobe. So that time you can code this one. Partial thyroid lobectomy, unilateral. Only part of this lobe is removed. That time you can code this one. 60210. Okay. So 60212 along with partial thyroid lobectomy, unilateral, the contralateral subtotal lobectomy, including isthmusectomy. Okay. So for example, patient is performing partial thyroidectomy on the right side and the left side subtotal. Here also half of the thyroid gland, not complete thyroid gland removal. So that time you can code this one 60212. Got it, guys? 210, 212. Any doubt? Clear?
So please no, sir.
Yeah. 210 is for removal of part of the thyroid lobe on the right side or left side. Okay. 60212 is contralateral side. Okay. So 1 second. So see this one. So this is the thyroid gland, left lobe and right lobe. For example, if you want to code 60210, patient will remove only this part. Okay, only this area of the right lobe. He will not remove complete unilateral thyroid lobe, only this area. So that time you can code this one 60210. 60212 partial thyroid lobectomy means in right side this part and the left side half of the thyroid, subtotal. So try to remember, subtotal is different, total is different. So that time you can use 60212. Okay. So here 60212, patient must and should needs to perform isthmusectomy. Then only you can code 60212. Okay. So clear, Starry?
Yes, sir.
Clear, na? Okay, cool. Next we have 60220. Total thyroid lobectomy, unilateral with or without isthmusectomy. 60225 with contralateral subtotal lobectomy including isthmusectomy. So this is complete thyroid lobe removal. So complete this area will be removed by the physician. Complete right lobe will be removed by the physician. So that time you can code this one 60220. Okay, and this is unilateral, and if the physician performs contralateral subtotal, again here also right side complete lobe, left side part of the left lobe. So that time you will use this one 60225. Okay, so mostly you will get this one 60220 for unilateral thyroid lobectomy. So 99% you will encounter this code 60220. Okay, mostly here physician will not perform any contralateral, but mostly you will get only unilateral total thyroid lobectomy. Okay, next 60240 thyroidectomy total or complete. Here physician will remove total thyroid gland, right lobe as well as left lobe. So that time we will code this one 60240 total or complete. 60252 thyroidectomy total or subtotal for malignancy with limited neck dissection. Okay, so along with this total thyroid gland, physician will remove the lymph nodes at the neck area also. So that time 60252. Mostly you will use 60252 for malignancy or thyroid cancer. Okay, so these codes most of the time for thyroid nodules. For example, your PDX will be thyroid nodule. If the patient performs total thyroidectomy, what do you code, guys? Unilateral total thyroidectomy.
60240.
No.
252.
No, unilateral I told, na?
Okay.
I told you, remember or not?
0220.
Perfect.
60220.
Yeah, 60220. So that is important. Okay. Here 240, patient will remove right and left, complete thyroid gland. That time you can code this one. Okay. So for example, patient is having the thyroid cancer. So physician has removed the total thyroidectomy or thyroid gland. How do you code?
60252.
60252. The code itself contains for malignancy. Means mandatorily you need to use this code for only for malignancy. Other than malignancy, you need to use these codes. Got it, guys? Clear? Clear?
Clear, sir.
Clear, sir.
Okay, great. So this is the thyroid lobectomy. Means only one side excision of the thyroid gland. Okay. 60250. Sorry, 254. So this is 252. This is a 254 is also for malignancy. But in 252, limited neck dissection. 254, radical neck dissection. So what is the difference between these two, guys? Limited neck dissection and radical neck dissection? So basically limited means here patient will remove few lymph nodes from the neck area. Okay. In 60254, patient will remove complete lymph nodes from the neck area along with thyroid gland for malignancy. So that time you will use 60254. 60260, thyroidectomy, removal of all remaining thyroid tissue following previous removal of a portion of thyroid. So this is the staged procedure like thing. So previously patient had thyroidectomy. Okay. So again patient had growth on the thyroid gland. So that time physician will perform this one 60260. Okay. See here, this is the keyword, all remaining thyroid tissue. So what do you check in the operative report? If you want to code this one 60260, what do you check in the documentation?
Previous thyroid.
Perfect. Perfect. So you need to check whether patient is having previous thyroidectomy or not. Okay. So if you want to code 60260, patient must and should needs to have previous thyroidectomy. Okay. 60270, thyroidectomy including substernal thyroid, sternal split or transthoracic approach, 60271 cervical approach. Okay, so basically these are self-explanatory. If the patient performs thyroidectomy using sternal split or transthoracic approach, 60270, 60271 cervical approach. So what is the difference between these two guys? Transthoracic versus cervical. What is transthoracic approach?
Open approach.
So where do you find transthoracic means? Where is the incision site?
Thorax.
Correct. Perfect. So thorax area. 271?
Cervical.
Yeah, neck area. So don't get confused in female genital system also we have cervix, correct? So that is cervical. This is also cervical. So based on documentation, based on your procedure, you need to code. Okay. Next we have 60280. Excision of thyroglossal duct cyst or sinus. Initial recurrent. So previously we have IND, correct? Incision and drainage of thyroglossal duct cyst infected. So this is for IND. So this is for excision. So if the patient performs first time excision of thyroglossal duct cyst, 60280. Okay. If the patient performs excision of thyroglossal duct cyst and recurrent means second time or first time, guys? Recurrent means
Second time.
perfect. Second time. So recurrent means basically reoccurrence. Okay. So like that you need to use these codes. Okay. So here mostly in live coding you will get this one 60220, 60240, 60252 as well as this one 60260. Only these codes mostly you will get. Okay. And sometimes you will get this also 60200 for excision of cyst or adenoma of thyroid. Okay. Next we have removal 60300 aspiration and or injection thyroid cyst. Okay. See here, as it is a cyst, here they did not mention excision. They have mentioned aspiration. Why means always cyst contains fluid. So cyst does not contain tissue. Okay. So that's why they have mentioned here it as cyst. That's why they have mentioned aspiration. Okay. Next, if the patient uses the imaging guidance, you need to use 76942 and 77012. Simple. Next, these are the thyroid gland or thyroid gland related procedure. Mostly you will get 220, 240, 252 and 260 as well as 200. Okay. Next we have parathyroid, thymus, adrenal gland, pancreas and carotid body. Okay. So parathyroidectomy or exploration of parathyroids 60500. So basically parathyroid is sits on the back side of thyroid gland. Okay. We have 4 parathyroid glands. If the patient performs removal of those parathyroid glands 60500. If the patient performs re-exploration of the parathyroid glands 60512. So this is basically initial examination of parathyroid gland. This is the second time examination of parathyroid gland. Okay. So next with mediastinal exploration, sternal split or transthoracic approach here also. So previously we have seen this approach for thyroid gland, correct? 60270. Substernal, thyroid, sternal split or transthoracic approach. So here it is for parathyroid gland. Simple. Okay. Parathyroidectomy or exploration of parathyroid with mediastinal exploration, sternal split or thoracic approach. Okay. So that is the thing you need to remember. Okay. Next we have 60512. This is the add-on code. So parathyroid auto transplantation, as it is a add-on code, you need to use this add-on code along with these procedures only. You can't use along with other procedures. Okay, 1 second guys. So like parathyroid auto transplantation. So sometimes what happens when patient will perform thyroidectomy, na? So as we have discussed, parathyroid gland sits on the back side of thyroid gland. I will show you once. So parathyroid gland. Okay. So these will sits on the back side of thyroid gland. See here, this is the back side of thyroid gland. 1, 2, 3, 4. Okay. So if the patient removes this thyroid gland, patient needs parathyroid gland, correct? So that time patient will replace this parathyroid gland at another location. So that time we need to use this one, 60212. Sorry, 60512. Okay. So you can use this 60512 along with all these procedures. Okay. See, these are the parathyroid glands. 1, 2, 3, 4. This is the back side of thyroid gland. Got it, guys? Clear? Hello?
Yes, sir, clear.
Okay, great. Thank you. So next, 60520. Thymectomy. Partial or total. Transcervical approach. 60521. Thymectomy. Partial or total. Sternal split or transthoracic approach without radical mediastinal dissection. This is also sternal split or transthoracic with radical mediastinal dissection. Okay. So this is without radical mediastinal dissection. This is with radical mediastinal dissection. Okay. Here also basically based on the keywords only you need to code. So here patient will not remove lymph glands. In 60522 patient will remove the lymph glands along with thymectomy. So now you need to understand where do you see thymus gland. Okay. So here is the thymus gland. Okay. So this is the thymus gland. Okay. So that time you will use this one, 520, 521, 522 based on these keywords. Okay. So these all are open procedures. Okay. If the patient performs same thymectomy using the VATS approach. So what is VATS, guys? You need to use 32673. What is VATS? We have completed all.
Video assisted
Video assisted.
Yeah, perfect.
thoracoscopic surgery.
Yeah, video assisted thoracoscopic surgery. Correct. Okay, like that. 60540. Adrenalectomy. Partial or complete or exploration of adrenal gland with or without biopsy. Transabdominal, lumbar or dorsal. 60545 with excision of adjacent retroperitoneal tumor. Okay, so where do you see adrenal gland? On the kidney.
On the top.
Yeah. So these are the kidney, adrenal gland. Okay. So anyway, you don't need to worry. You will not get those. Just directly you will get thyroid and parathyroid only. But we need to learn now. Okay. So that time you need to use 450 based on approach. Transabdominal, lumbar or dorsal. 60545 excision of adjacent retroperitoneal tumor. Okay. So these are open procedure. For laparoscopic you need to use 60650. Okay. Next 60600. Excision of carotid body tumor without excision of carotid artery with excision of carotid artery. So we need to understand where do you see carotid artery, guys? So carotid artery presents in neck area. Carotid body tumor. See here? Neck area basically. See, this is the carotid artery. See, this is the paraganglioma. Just tumors. So that time, see, this is only this one. So that time you can use this one. 60600 without excision of carotid artery. 60605 with excision of carotid artery. Simple. Okay. Next, here we have laparoscopic approach. We will not code, but we need to learn. 60650. Laparoscopy surgical with adrenalectomy. So if the patient performs laparoscopic adrenalectomy, that time we will code 60650. We have only one code here from the laparoscopic approach of adrenalectomy. Okay. Next we have 60659, unlisted laparoscopic procedure, endocrine system. If you are unable to find any code related to endocrine system, you can use this one, 60659. So for example, we are coding endocrine system procedure, open approach. So can you use this code, unlisted code or not? 60659.
No.
Why?
No, we should not use
Why?
laparoscopy procedure.
Perfect.
This one
Laparoscopy
unlisted.
approach.
Yeah, correct. So you can't use this one for open approach. You need to use this unlisted code only for a laparoscopic procedure. Simple. Okay. So other procedure 60660, ablation of one or more thyroid nodules, one lobe or the isthmus percutaneous, including imaging guidance, radio frequency. Okay. If the patient perform ablation of thyroid nodule. Okay. So previously we have seen excision, correct? So here we have excisions. Here we have excisions. Excision of cyst or adenoma of thyroid or transection of isthmus. These are excisions of cyst and adenoma. Okay. So this is for ablation of thyroid nodule. So that time 60660. Here your key term in order to use this code is radio frequency ablation. Okay. If the patient performs laser ablation, unit code 0673T. Okay. So what is important here? Whenever you want to code ablations, you need to check the documentation. What do you check, guys? What do you check?
Laser.
Yeah, like approach you need to check. How physician is using, what physician is using, radio frequency or laser. So radio frequency 60660, laser 0673T. Okay. Next 60661, ablation of one or more thyroid nodules, additional lobe, percutaneous, including imaging guidance, radio frequency. Okay. So for example, if the patient is performing one nodule on the left lobe and one nodule on the right lobe, how do you code, guys? So ablation of one nodule on the left lobe, one nodule on the right lobe using radio frequency.
60660.
60660 and
Only one code?
60661 also.
Perfect.
For additional lobe.
Yeah, correct. So patient is performing 3 nodules on the left side and 4 nodules on the right side. How do we code?
Only one time.
60660.
You need to this also, na? Each additional lobe.
Both.
Yeah, both again. So irrespective of number of nodules, you need to use same code. Just what is your key thing? Whether patient is performing ablation in single lobe or additional lobe. And technique. Whether it is radio frequency ablation or laser ablation. Simple. Okay. So for example, if the patient is performing open endocrine system, if you are unable to find any code in the CPT code book. So that time we need to use 60699. Okay. So just remember, this is for laparoscopy procedure, unlisted code. This is for open procedure, endocrine system. Okay, simple. See, this is also endocrine, this is also endocrine. So you can use this one. Only difference is approach. This is for open approach, this is for laparoscopic approach. Simple. Okay. So any doubt, guys, here? Endocrine system clear? Endocrine system is one of the very important same day surgery procedure you will encounter. Mostly thyroidectomy and parathyroidectomy. So any doubts here? So tell me now, what do you check, Swapna, while coding thyroidectomy procedure? What do you need to check? Keywords, basically.
Approach and
in what of the is the process is occurring, like partial thyroid or total thyroid,
Okay.
and what is the approach?
Okay.
If it is cancer or malignant, we have separate codes.
Perfect. Yeah. So you're in the same path, just once it is sometimes difficult to remember, just you need to practice at home also. Again, if you